If you have peritoneal mesothelioma or you're being evaluated for it, you've probably heard the term ascites, Ascites. It refers to a fluid buildup in the abdomen, and it's one of the hallmark symptoms of peritoneal mesothelioma. It causes visible abdominal swelling, discomfort, and a range of other problems. Today, I want to explain what ascites is, why it develops in peritoneal mesothelioma, how it's different from normal abdominal bloating, how it's treated, and what it means for your overall condition. I'm Terri Oppenheimer, and I've been writing about mesothelioma and asbestos for the website mesothelioma.net for over a decade. I'm not a physician, and this is not medical advice. But if you know what ascites is, it will help you recognize this important symptom and seek appropriate treatment sooner rather than later. Now, to understand what ascites is, let's start by discussing where it happens. The peritoneum is a thin membrane that lines the abdominal cavity and covers the abdominal organs, including the stomach, intestines, liver, and spleen. Normally, there's a very small amount of fluid in that cavity, just enough to allow those organs to move smoothly against each other. Ascites refers to a condition in which excess fluid accumulates in this cavity. Instead of just a small amount of lubricating fluid, you might have a liter or two or even several liters of fluid filling the abdomen. It causes visible swelling, pressure, discomfort, and functional problems. Why does ascites develop in peritoneal mesothelioma? The mechanism is similar to the pleural effusions that arise in pleural mesothelioma patients. Tumors growing on the peritoneum disrupt the normal balance of fluid production and absorption. This blocks the lymphatic channels that would normally drain fluid from the peritoneal cavity. Cancer can also cause inflammation that increases the production of fluid. And additionally, the tumors themselves can secrete fluid and blood vessels can become more permeable and leak fluid into the abdominal cavity. The result of all of these is excess fluid that accumulates progressively over weeks or months. Now, before I go on, I'm going to take a break and ask you a quick favor. If you find these videos helpful, please hit the like and subscribe buttons below. It makes it easier for other people who need this information to find us. Also, if you have questions or there's a topic you'd like to see addressed in a future video, send me a note in the comments section. And make sure you watch until the end, because I'm going to give you valuable information on where to find resources that will make a real difference for you. Now, let's discuss the symptoms of ascites. The most obvious symptom is abdominal swelling or distension. When ascites forms in your abdomen, it becomes visibly larger. Your clothes don't fit properly because your waistline is expanding significantly. The swelling can be gradual, developing over weeks, but sometimes it seems to happen overnight. Abdominal discomfort or pressure, they're common. You may notice a feeling of fullness or tightness, and you may feel full after eating very little because the fluid is taking up space that your stomach would normally expand into. This can lead to poor appetite and weight loss, even as your abdomen is swelling. When massive ascites pushes up on the diaphragm, it limits lung expansion and breathing can become extremely difficult. This is particularly problematic when patients are lying flat. Digestive symptoms like nausea, heartburn, or constipation can develop from pressure on the digestive organs, and you can experience lower back pain from the weight and pressure of the fluid. Your legs and ankles can swell as fluid shifts, and you may find it difficult to bend over or move comfortably because your swollen abdomen is in the way. Now, how is ascites diagnosed? Physical examination often reveals a distended abdomen that feels tense or firm. Your doctor may detect what's called a fluid wave. It's when one side of the abdomen is tapped and a wave of movement travels through the fluid to the other side. Abdominal ultrasound easily detects ascites and can also estimate the volume of fluid, while a CT scan shows ascites and also shows the underlying peritoneal abnormalities like thickening, nodules, or masses that would be indications of mesothelioma. The fluid itself often has a characteristic appearance on imaging studies. How is ascites treated in peritoneal mesothelioma? Paracentesis is the first-line treatment. It's a procedure where a needle is inserted through the abdominal wall into the peritoneal cavity to drain the fluid. This is done with local anesthesia in a clinic or at the patient's bedside. The needle is connected to a catheter and drainage bottles, allowing removal of large volumes of fluid, sometimes 5 to 10 liters or more. Paracentesis will provide immediate symptom relief. Patients typically feel dramatically better after drainage. Breathing gets easier, abdominal pressure is relieved, and your appetite may improve. However, like pleural effusions, ascites in mesothelioma almost always recurs. Fluid will reaccumulate over days to weeks because the underlying tumor is still disrupting the balance of fluid. For recurrent ascites, treatment options include placement of a peritoneal catheter in the abdomen. This allows patients to drain fluid at home as needed, without repeated paracentesis procedures. Treating the underlying mesothelioma is critical. Systemic chemotherapy can reduce the tumor burden and the inflammation, and sometimes it reduces ascites production. For peritoneal mesothelioma specifically, cytoreductive surgery with HIPEC, which removes all the visible tumors and treats the abdomen with heated chemotherapy, can eliminate ascites by removing the source. This is one of the major benefits of successful cytoreductive surgery. Patients whose tumors are completely or nearly completely removed often have a permanent resolution of their ascites. Diuretics, which are medications that increase urination, they're sometimes used to reduce fluid accumulation, but they're less effective for malignant ascites than for ascites from other causes like liver disease. Dietary modifications like reducing salt intake might help minimally, but it won't control significant malignant ascites. You may be wondering what happens if ascites is left untreated. The answer is nothing good. Massive ascites severely impairs quality of life. It leads to difficulty breathing, an inability to eat adequately, and extreme discomfort. Spontaneous bacterial peritonitis, which is an infection within the ascitic fluid, can develop, and this creates a medical emergency requiring antibiotics. Hernias can develop from the increased abdominal pressure pushing organs through weak spots in the abdominal wall. And malnutrition can develop when ascites keeps you from eating enough. That's why managing ascites is such an important part of peritoneal mesothelioma care, even when a cure is impossible. How is ascites different from other causes of abdominal swelling? People sometimes confuse ascites with bloating from gas or digestive issues, but they're very different. Bloating from gas or constipation is usually temporary. It comes and goes, it responds to over-the-counter remedies, and it doesn't cause the massive abdominal distension that's seen with ascites. Ascites is progressive, persistent, causes a significant, measurable increase in abdominal girth, and it doesn't respond to digestive remedies. Weight gain from fat accumulation happens gradually and evenly, where ascites can cause 10 to 20 pounds or more of weight gain over weeks as the fluid accumulates. Can you prevent ascites in peritoneal mesothelioma? Not directly, because it's a consequence of the tumor. However, early and effective treatment of the mesothelioma itself, particularly cytoreductive surgery with HIPEC for eligible patients, can prevent or eliminate ascites by removing the tumors that cause it. What does ascites mean for prognosis? The presence of ascites indicates the presence of active peritoneal mesothelioma that's affecting peritoneal function. However, ascites alone does not determine prognosis. Many patients with ascites respond well to cytoreductive surgery with HIPEC and achieve long-term survival along with the resolution of the ascites. The amount of ascites and how quickly it reaccumulates after drainage can provide some clue about how aggressive the disease is. But this has to be weighed alongside other factors like cell type, tumor burden, and treatment response. Managing ascites is about maintaining comfort and function. Even when complete removal of mesothelioma tumors isn't possible, controlling ascites allows patients to eat properly, breathe comfortably, and maintain a better quality of life. So, to review, ascites is an excessive accumulation of fluid in the abdominal cavity, and it's a hallmark symptom of peritoneal mesothelioma. It causes visible, massive abdominal swelling, pressure, breathing difficulty, and feeling full after eating far too quickly. Ascites develops because tumors disrupt normal fluid balance in the peritoneum, and treatment includes paracentesis for drainage, peritoneal catheters for recurrent ascites, and most importantly, cytoreductive surgery with HIPEC for eligible patients that can permanently resolve ascites by removing the tumors. Visit mesothelioma.net for information about ascites and peritoneal mesothelioma treatment. Or if you want to speak with one of our patient advocates right away, call 1-800-692-8608 or use the live chat feature on our website. As for me, remember to post questions below, and I'll see you next time.